I think the major issue is that the disease is asymptomatic. We generally don't see patients with kidney disease until they're very late stage, because only about 20% of people who have kidney disease are diagnosed and informed that they have kidney disease. So that's a really huge issue for us, is that when we see patients, we're often seeing patients late stage when we really can't do much to intervene and prevent kidney failure.
Chronic kidney disease is on the rise because of the lifestyle factors that we have chosen as a country. Eating processed foods, eating a lot of fast foods, also the inactivity of a lot of people being on computers and sitting a lot more watching TV, not being as active as we used to be. Also, the use of drugs and alcohol are a big factor. All of those things together all lead to a rise in chronic kidney disease.
It's really important for us to think about who is at risk for kidney disease and try to start doing testing in these people and communicating the results with the patients. Early detection of kidney disease could probably have the biggest impact on the incidence of kidney failure moving forward. Because if we catch kidney disease early, our therapies, including multiple different medication classes, blood pressure control, and diet, exercise, education, are so much more effective in delaying kidney disease progression.
Patients with chronic kidney disease have to be very careful with their diet. Processed foods have a lot of sodium and a lot of preservatives that cause some of their levels of phosphorus or their blood pressure to go up. And so we try to keep them eating healthier foods, which are whole foods, whole grains, things that are not in boxes, processed, put in the microwave.
Meeting with a dietitian to manage chronic kidney disease should be a first critical, essential step. And less than 10% of patients who have kidney disease are ever referred to a dietitian, even though Medicare and most insurance will provide medical nutrition therapy for people who have kidney disease with no cost sharing to the patient. Yet the patients are not being referred. It's a huge, huge gap in care. We now have 4 different classes of medications that can reduce kidney disease progression, even prevent people from ending up on dialysis. And it can be implemented really almost at all stages up until where they're starting dialysis. And I think that if we were to start implementing these in earlier stages, we could probably prevent the majority of kidney disease and kidney failure. The problem is that most patients, they're still not getting these medication classes. We see the people who are most likely to suffer with kidney disease and kidney failure are people who are non-white race and people who have low education, poor access to healthcare services. And I would say the overwhelming majority of patients with kidney disease are never fully educated on how to manage their own disease and keep them off dialysis. There's a huge educational campaign that needs to be done. We would be focusing on poor communities or communities that have a high number of Black and African American populations, Hispanic populations, because those are really high-risk groups. The way that Congress could really help to improve health equity for kidney disease and reduce these huge disparities in kidney failure would be to invest in education and awareness of kidney disease, educate clinicians, and educate high-risk communities about the importance of kidney disease testing. And right now, we're spending $147 billion every year on dialysis, and we're spending about $6 million on the education of the US population on the importance of kidney disease. It's a huge discrepancy.
Dialysis can absolutely be delayed, and if the patient knows that they have some kind of chronic kidney failure, or even beforehand if they have hypertension or they have diabetes, and we can keep them from progressing.
We don't have to think about kidney disease equating with I'm going to go on dialysis. That's not the reality anymore. If you see someone, they can give you therapies, give you medication, alter your diet, alter your lifestyle. You can prevent kidney failure. Kidney disease doesn't mean you have to go on dialysis. It doesn't have to be part of your life.